Did you know that prostate cancer is the second most common cancer in men worldwide? Even more alarming, 1 in 8 men in the United States will be diagnosed with prostate cancer in their lifetime. These numbers are a stark reminder that this disease is a serious threat, and early detection is crucial. Prostate cancer, a disease that affects the small walnut-shaped gland in men responsible for producing seminal fluid, is a global health concern. While it can be a life-threatening condition, the good news is that early detection significantly increases the chances of successful treatment and recovery. That's why it's vital for every man to be aware of the potential signs and symptoms, and today, we're going to delve into 10 critical ones you should never ignore. Despite its prevalence, many men remain unaware of the signs and symptoms of prostate cancer. This lack of awareness can lead to delayed diagnosis, which in turn can have serious consequences. It's time to break the silence and empower men with the knowledge they need to take control of their health. Make sure you watch this video to the end because we will also share with you proactive steps to protect your prostate health. In no particular order, here are 10 potential signs of prostate cancer that every man should be aware of. 1. Frequent urination. Think of your prostate like a donut, with your urethra, the tube that carries urine from your bladder, as the hole in the donut. Your prostate gland surrounds this hole. Now, when prostate cancer develops, the prostate gland can become enlarged, and this enlarged prostate presses on the urethra, like squeezing the donut. This pressure irritates the urethra and makes you feel like you must pee more often, even if your bladder isn't full. You might wonder why this is especially noticeable at night. Well, at night, our bodies produce less of a hormone that concentrates urine, meaning we produce more urine overall. This puts extra pressure on the already squeezed urethra. Also, when you lie down, fluids shift in your body, putting more pressure on your bladder and making you feel the urge to urinate more frequently. Now, it's important to remember that frequent urination is a common symptom of many conditions, not just prostate cancer. It could be something like benign prostatic hyperplasia, a urinary tract infection, or even just drinking too much fluid before bed. However, even though it might seem like a minor annoyance, frequent urination, especially at night, can be an early clue that something's not quite right with your prostate. So if you notice a change in your urination habits, don't brush it off. Talk to your doctor. It could be nothing serious, but it's always better to be safe and get it checked out. Early detection is key when it comes to prostate cancer. 2. Weak or interrupted urine stream. Imagine your urethra, the tube that carries urine from your bladder, is like a garden hose. Normally, the urine flow is strong and steady, like when you first turn on the hose, but now, imagine something partially blocking that hose, like a kink or debris buildup. What happens? The water stream becomes weak. It might sputter, or it could even stop and start. This is like what can happen with an enlarged prostate. It can squeeze the urethra, restricting the urine flow and making it weak, hesitant, or interrupted. A healthy prostate allows urine to flow freely and forcefully, but an enlarged prostate can constrict the urethra, leading to a weak or dribbling stream. It might even squeeze the urethra intermittently, causing the urine stream to stop and start. Now, it's important to remember that this doesn't automatically mean prostate cancer. A weak or interrupted urine stream can also be caused by other things like urinary tract infections, where inflammation and swelling obstruct the flow, or strictures, which are narrowings of the urethra. Even bladder stones can temporarily block the flow of urine. However, if you notice a persistent change in your urine stream, you must see your doctor. They can figure out what's causing the problem and recommend the proper treatment. Remember, early detection is key when it comes to prostate cancer, so don't ignore changes in your body, even if they seem minor. Your health is worth it. Have you found this video helpful so far? If yes, please like and subscribe. Now let's move on. 3. Pain or burning during urination. Think of your urethra, the tube that carries urine from your bladder, as a sensitive pathway. Usually when you pee, it's a smooth and comfortable process. But imagine that pathway becoming irritated and inflamed, like a sunburn on your skin. Ouch! That's a similar feeling to what you might experience when there's a problem with your prostate or other parts of your urinary system. When the prostate gland becomes enlarged or inflamed, it can put pressure on the urethra. This pressure, along with any inflammation in the prostate itself, can create a burning or painful sensation when you urinate. It's like the urine is passing over a raw, sensitive area. Now, this discomfort isn't always a sign of prostate cancer. It could be due to other reasons, like a urinary tract infection. UTIs cause inflammation in the urethra and bladder, leading to pain and burning during urination. Some sexually transmitted infections can also cause inflammation and discomfort in the urinary tract. Another possibility is prostatitis, which is an inflammation of the prostate gland that bacterial infections or other factors can cause. However, if you experience persistent pain or burning during urination, it's important to see your doctor. They can figure out what's causing the problem and recommend the right treatment. While dismissing this symptom as just a minor inconvenience might be tempting, don't ignore it. It could be your body's way of telling you something's not quite right. And when it comes to prostate health, early detection is crucial. 4. Blood in urine or semen. Let's talk about why finding blood in your urine or semen is a serious red flag that you should never ignore. Think of your urinary and reproductive systems as a network of delicate pipes and passages. Typically, the fluids that pass through these systems, urine and semen, are clear or slightly cloudy. Now imagine seeing blood mixed in with these fluids. That's a clear sign that something isn't right and could be causing damage within those systems. When it comes to the prostate, blood in the urine or semen can be a warning sign of several conditions, including prostate cancer. An enlarged prostate, whether due to cancer or other reasons, can sometimes cause blood vessels in the prostate or surrounding tissues to become fragile and rupture. This can lead to blood appearing in your urine or semen. Now, it's important to remember that blood in the urine or semen isn't always a sign of prostate cancer. Urinary tract infections, for example, can cause inflammation and bleeding in the urinary tract. Kidney stones, those hard mineral deposits, can also scrape the urinary tract as they pass and cause bleeding. Similarly, bladder or kidney infections can lead to blood in the urine. Even prostatitis, an inflammation of the prostate gland, can sometimes cause blood to appear in the urine or semen. However, because blood in the urine or semen can indicate a serious issue, it's crucial to see your doctor immediately so they can figure out what's going on. They can perform tests to determine the underlying cause and recommend the right treatment. Never ignore this alarming sign. It's always better to err on the side of caution and get it checked out promptly. And remember, early detection is key to successful treatment and a positive outcome. 5. Difficulty with erection. Let's talk about why difficulty with erections, also known as erectile dysfunction or ED, can sometimes be a potential sign of prostate cancer. Think of the process of getting an erection like a well-coordinated team effort. It involves your brain hormones, blood vessels, and nerves all working together smoothly. Now, imagine one of the team members isn't pulling their weight. That can throw off the whole process and lead to difficulty achieving or maintaining an erection. When it comes to prostate cancer, there are a few ways it can interfere with this team effort. The nerves that control erections run very close to the prostate gland. If prostate cancer grows or spreads, it can put pressure on or damage these nerves, disrupting the signals needed for an erection. Prostate cancer treatments, such as surgery or radiation, can sometimes affect hormone levels, which also play a crucial role in erectile function. And of course, a diagnosis of prostate cancer can understandably cause anxiety and stress, which can contribute to ED as well. Now, it's important to stress that erectile dysfunction is very common, and it's often caused by factors that have nothing to do with prostate cancer. As men age, the ability to achieve an erection can naturally decline. Stress and anxiety can also significantly impact erectile function. Conditions that affect blood flow, like heart disease, can also affect blood flow to the penis, making erections more difficult. Diabetes can damage nerves and blood vessels, which can also lead to ED. Certain medications can have side effects that contribute to ED. However, if you're experiencing persistent or recurring erectile dysfunction, it's essential to talk to your doctor. They can help determine what's causing the problem and recommend appropriate treatment options. While it can be an uncomfortable topic to discuss, don't ignore this potential sign. It's important to remember that ED is often treatable, regardless of the cause. And when it comes to prostate cancer, early detection is always the best approach. Have you found this video helpful so far? If yes, please like and subscribe. 6. Pain or stiffness in the lower back, hips, or upper thighs. Let's explore why pain or stiffness in the lower back, hips, or upper thighs can sometimes be a concerning sign, especially when it comes to prostate health. Imagine your bones as the scaffolding that supports your body. Typically, they're strong and allow you to move freely without discomfort. But sometimes, cancer cells can spread from their original location, like the prostate, and travel to other parts of the body, including the bones. When prostate cancer spreads to the bones, it can weaken them and cause pain or stiffness. This happens because the cancer cells disrupt the normal bone structure and can even cause tiny fractures. The areas most affected by prostate cancer that has spread to the bones are the lower back, hips, and upper thighs. Now, it's important to understand that pain in these areas is very common and often caused by things completely unrelated to cancer. Everyday activities or exercise can cause muscle strains or sprains, leading to pain and stiffness. Arthritis, which causes joint inflammation, can lead to pain and stiffness, especially in the hips and lower back. Sciatica, a type of nerve pain that radiates from the lower back down the legs, can also cause pain and numbness. Osteoporosis, a condition that weakens the bones, can make them more prone to fractures and pain. However, if you experience persistent or worsening pain in your lower back, hips, or upper thighs, especially if it's accompanied by other symptoms like fatigue, unexplained weight loss, or changes in urination, it's important to see your doctor. They can help determine what's causing the pain and recommend appropriate treatment. While it's easy to dismiss aches and pains as we get older, paying attention to your body and seeking medical advice when something doesn't feel right is crucial. Early detection is key, especially when it comes to prostate cancer that may have spread. 7. Unexplained weight loss. Think of your body like a car. To run properly, it needs fuel, which comes from the food you eat. Now, imagine your car suddenly starts losing fuel, even though you haven't changed your driving habits. That's a sign that something might be wrong under the hood, right? Similarly, when your body starts losing weight without any obvious reason, like changes in your diet or exercise routine, it can be a signal that something's not quite right internally. When it comes to prostate cancer, unexplained weight loss can happen because cancer cells grow and multiply rapidly, and they require a lot of energy to do so. They can essentially steal energy and nutrients from your body, leading to weight loss. Cancer can also disrupt your body's normal metabolism, converting food into energy, which can further contribute to weight loss. Additionally, prostate cancer can sometimes affect hormone levels, which can influence your appetite and metabolism. Now, it's important to remember that many factors, not just cancer, can cause unexplained weight loss. Stress and anxiety can affect your appetite and lead to weight loss. An overactive thyroid gland, a condition known as hyperthyroidism, can speed up your metabolism and cause you to lose weight. Digestive problems like celiac disease or inflammatory bowel disease can interfere with nutrient absorption and lead to weight loss. And some infections can cause weight loss as your body fights them off. However, if you experience sudden and unexplained weight loss, especially if it's significant or accompanied by other symptoms like fatigue, changes in urination, or pain, it's important to see your doctor. They can help figure out what's causing the weight loss and recommend appropriate treatment. While it's tempting to celebrate unexpected weight loss, it's crucial to pay attention to your body and seek medical advice when something seems off. Early detection is key, especially when it comes to potential health concerns like prostate cancer. 8. Fatigue. Think of your body like a battery. Throughout the day you use energy, and at night you recharge through sleep. But imagine your battery constantly draining, even after a good night's rest. That's a sign that something might be draining your energy reserves. When it comes to prostate cancer, fatigue can occur for several reasons. As we discussed earlier, cancer cells are like energy hogs. They require a lot of energy to grow and multiply, leaving you feeling drained. Prostate cancer can sometimes lead to anemia, a condition where you have a lower than normal number of red blood cells. These cells carry oxygen throughout your body, and a shortage can lead to fatigue. Treatments for prostate cancer, such as surgery, radiation, or hormone therapy, can also cause fatigue as your body copes with the effects. And of course, dealing with a cancer diagnosis and treatment can be emotionally and physically exhausting, which can also lead to fatigue. Now, it's important to remember that fatigue is a very common symptom, and it can be caused by many factors that have nothing to do with cancer. Not getting enough quality sleep can leave you feeling tired and sluggish. A diet lacking in essential nutrients can also contribute to fatigue. Stress and anxiety can take a toll on your energy levels. Depression is often accompanied by fatigue and low energy, and some medications can cause fatigue as a side effect. However, if you experience persistent fatigue that doesn't improve with rest or lifestyle changes, especially if it's accompanied by other symptoms like unexplained weight loss, changes in urination, or pain, it's important to see your doctor. They can help determine what's causing the fatigue and recommend appropriate treatment. While it's easy to brush off fatigue as just a part of modern life, It's crucial to listen to your body and seek medical advice when something feels amiss. Early detection and addressing any underlying health issues, including prostate cancer, is always the best course of action. Have you found this video helpful so far? If yes, please like and subscribe if you have not done so. 9. Swelling in legs or feet. Now imagine a dam blocking one of those rivers. The water would back up and cause flooding, right? Similarly, when something obstructs your body's normal flow of fluids, it can lead to swelling. This is what can happen with advanced prostate cancer that is spread to the lymph nodes. Lymph nodes are small, bean-shaped glands that are part of your body's immune system. They filter out waste and help fight infection. However, when cancer spreads, it can sometimes reach these lymph nodes and disrupt their normal function. If prostate cancer spreads to the lymph nodes in the pelvis, it can block the flow of lymph fluid, causing fluid to build up in the legs and feet and leading to swelling. Now, it's important to understand that swelling in the legs and feet can be caused by many factors, not just cancer. Conditions like heart failure can make it harder for your heart to pump blood effectively, leading to fluid buildup in the lower extremities. Kidney problems can also disrupt fluid balance in the body and cause swelling. The liver plays a role in regulating fluid levels, and liver problems can also lead to swelling. Some medications can cause fluid retention and swelling as a side effect. Even prolonged standing or sitting can cause fluid to pool in the lower legs and feet. However, if you experience persistent or unexplained swelling in your legs or feet, especially if it's accompanied by other symptoms like fatigue, unexplained weight loss, changes in urination, or pain, it's crucial to see your doctor. They can help determine the underlying cause and recommend appropriate treatment. While swelling in the legs and feet can be common, it's important to pay attention to your body and seek medical advice when something seems unusual. Early detection and addressing any underlying health issues, including advanced prostate cancer, is always the best approach. 10. Loss of bladder or bowel control. Think of your bladder and bowels like containers with tightly sealed lids. You control when and where you release those lids to empty the containers. But imagine those lids becoming loose or damaged. That would lead to accidental leaks and a loss of control. Similarly, when it comes to bladder or bowel control, your body relies on a complex system of muscles, nerves, and sphincters. They are circular muscles that act like valves to keep things contained. However, in cases of advanced prostate cancer, this control can be compromised. If prostate cancer grows large enough or spreads to surrounding tissues, it can put pressure on or damage the nerves and muscles involved in bladder and bowel control. This can lead to leaking urine, either in small amounts or in larger, uncontrollable bursts, which is known as urinary incontinence. It can also lead to the inability to control bowel movements, causing accidental leakage of stool, which is called fecal incontinence. Now, it's important to remember that loss of bladder or bowel control can be caused by many factors, not just advanced prostate cancer. As we age, the muscles that control bladder and bowel function can weaken. Conditions like diabetes or multiple sclerosis can damage the nerves that control these functions. Pelvic floor disorders, which involve weakening of the muscles that support the pelvic organs, can also lead to incontinence. And chronic constipation can overstretch the bowel muscles, leading to fecal incontinence. However, if you experience a sudden or gradual loss of bladder or bowel control, especially if it's accompanied by other symptoms like blood in the urine or semen, pain in the lower back or hips, or unexplained weight loss, it's crucial to see your doctor immediately. They can help determine what's causing the problem and recommend appropriate treatment. While loss of bladder or bowel control can be distressing and embarrassing, it's important to remember that it's often treatable. And when it comes to potential underlying causes like advanced prostate cancer, early detection and intervention are critical. This is why you should take proactive steps to protect your prostate health by doing the following. If you are over 50, see your doctor for a detailed prostate exam. These checks help detect potential problems early on, even before you notice any symptoms. Also, if you have a family history of prostate cancer, meaning your father or brother had the disease, your risk is higher. In this case, it's recommended to start having regular checkups even earlier, typically around age 40. This allows for closer monitoring and early detection of any changes or abnormalities of your prostate. Imagine a life where you can enjoy your passions, spend time with loved ones, and live to the fullest. Early detection of prostate cancer can make that a reality. Don't let procrastination steal your future. Be proactive and take charge of your health today. Remember, experiencing one or more of these symptoms doesn't necessarily mean you have prostate cancer. However, it's crucial to consult with your doctor for proper evaluation and diagnosis. Early detection is key to successful treatment and a positive outcome. Have you or someone you know experienced any of these symptoms? Share your stories and experiences in the comments below. Let's raise awareness and support each other on this journey to better health. And don't forget to like and share this video with your friends and family. Subscribe to my channel for more informative content on health and wellness. Thank you for watching.